It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hello everyone, I'm Dr. Annie Varughese and welcome back with another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that help change people's lives. We have a great show for you today. Let's learn more about our first doctor, Dr. Gabriel Maislos.
A bunion deformity is a deviation of the first metatarsal and the second metatarsal. So basically, you know, what people see of their big toe is this. So the big toe is pointing this way, and this bone is going out this way. When it's not matching up well, you get bone growth. And so bone starts to build up right here, and it also starts to build up top.
I spend about 85% of my time traveling, so I'm in and out of the airports. As a training manager, I do a lot of facilitation. So I'm on my feet a lot walking, and it got to the point where even flat shoes, what most people would think is comfortable shoes, became painful.
Her surgery was an osteobunionectomy, but it was a little bit different because on the x-ray I discovered that she had severely arthritic joint. She had fracture fragments. So these fracture fragments never healed. And because they were constantly moving, it was severe pain. It caused an enormous amount of bone growth on the top and on the side. So I was really excited to do her surgery because I knew it would provide immediate relief.
I'll be wearing the boot for at least another 4 weeks, and then I'll come back for another reassessment. And then he'll determine then whether I can take the boot off and then just start walking in normal shoes.
People always ask, you know, why do I have this problem? And the biggest component, genetics. So if you look at your parents' feet or your grandparents' feet, it's basically telling you, if you see a bunion deformity, that your chances are your feet are going to develop these structural deformities. Then, obviously, for the females, it's wearing the high heels. You know, it's there's a price to pay for high fashion. You wear the high heel, it puts your foot in position, which predisposes you to a bunion deformity.
Well, I would love to be able to get back out there and be pain-free. A lot of times, I couldn't wait for the day to end because I would be in so much pain. So I'm looking forward to being able to be on my feet for a longer period of times pain-free.
The look on the patient's face when they come in and they see the results and they're happy with the results, and they see that instead of having a crooked toe, or that it's actually straight, and that the pain that they had before is gone. So, you know, that's the rewarding part to me.
My biggest problem was that I got several allergies. I couldn't breathe. I was snoring at night. I was sneezing a lot during the mornings when I woke up. And I was always having nose discharge.
Irma is a young professional who came to see me because she can't breathe through her nose. She has this chronic problem that never went away. She consulted many doctors, and all she got was, you know, a prescription of antibiotics, and that's it.
Since I was a child, I had that problem. I've been treated for allergies. I get better for specific periods of time, but I travel a lot. I travel internationally, so it's different pollens and different trees, or the landscape is totally different, so I couldn't find a solution.
Doctors has treated Emma's problem with multiple course of antibiotics. I see this condition all the time. Patient has been treated with antibiotics, antibiotics, antibiotics. The problem is that antibiotics may improve your symptoms, but it will mask the cause of the problem.
He explains you everything. He shows you, you know, like with endoscopy, I could see my nose inside. I saw where parts were infected, and he was telling me what what he can do for me and what will be the results.
Decide upon a plan of treatment consisting of endoscopic sinus surgery assisted with GPS-like technology to target her diseased sinus.
He really accommodated the surgery to my lifestyle. He already told me, you are going to follow your allergy treatments with me, and now everything is working perfectly for me.
We are at the forefront of medical technology to improve our patient outcome. We want our patient to recuperate faster and feel better.
I'm breathing, I feel healthier, I feel younger. I highly recommend the sinus surgery for everybody that has chronic cold infections.
That's a fabulous question. Very important for people to know that 50% of the time people with coronary disease don't even have chest pain. They don't have any symptoms. So sometimes people can have a heart attack and not have chest pain. Sometimes people can have chest pain but not be having a heart attack, but just have something called angina or decreased blood flow to the heart. Whatever the symptom is, whether it's chest pain, shortness of breath, palpitations, just a funny feeling in the heart. Oftentimes women may say that they just feel less able to do the things that they do, less able to take care of the things in their household daily environment. So if people have symptoms, definitely they should be checked. If they don't have symptoms, they just are worried about heart attack or stroke or family history of heart attack, just go and see your doctor. Every physician is able to evaluate the heart. You don't have to go to a cardiologist. You can start with your primary care doctor that can give great care, and then go and see a cardiologist for further evaluation.
Osteoporosis is a disease. It's a disease of bones. It manifests as either a fracture or the realization that the bones are very, very thin with a high risk of fracture. It's important. It's common. It happens in over 50% of women postmenopausal. That's to say, over half of women over the age of 50 are going to have a fracture in their lifetime. And it's serious because some people that have hip fractures will die very quickly. And some people will go into a nursing home and not get out. Since it's a function of time and duration of estrogen deficiency, the time since estrogen deficiency with the thinning of the bone is predictable. It may be needed sooner if there are other risk factors for thinning of the bone sooner. Smoking, extreme thinness, sedentary lifestyle, parents' history, or a previous low trauma fracture. Most objective way to quantitate the status of the bone health, thickness or thinness, is to measure the areas of interest of the spine and the hip, since those carry the most risk of morbidity and mortality. It's done on an X-ray type device called a bone density unit. It's painless, it's easy, it's safe, involves lying on a table and being positioned as you're able. It's not exactly the same as doing x-rays for fractures, although it may be more sensitive for certain kinds of painless fractures. It's not for diagnosis of various diseases or fractures in general. The ultimate goal of screening is to prevent death and disability from fractures. We're trying to predict fractures based on age and the thickness of the bone. If someone has very thin bone, then they have a very high risk for fracture. We recommend that all women have bone density testing at age 65 and sooner if they have risk factors that would indicate that they would have high or increased risk for fracture.
Many patients complain of leg pain from vein problems. Veins can dilate, they can become aesthetically unpleasing, but they can also cause vascular abnormalities which can lead to clot formation. Dr. Peter Morgan is a vein specialist, and let's look at this segment how he has helped one patient about a vein problem.
Debbie presented with severe swelling and large bulging veins in her legs, one leg much worse than the other. She had coexistent, severe, very advanced osteoarthritis in her knees, so she really had some big problems with both of her legs.
Every morning and every night I would measure my ankles and just below my knees. I would have a difference of sometimes as much as 1.75 inches between morning and evening. And when I saw Dr. Morgan, he discussed the options with me, and then, as I said, having double knee replacements, and 3 doctors whom I highly respected all said, get it done before you have your knee replacement because it will do so much in aiding the healing.
Before having her knee surgery, she came in to us to have her veins treated. We did ablations on her legs. Her swelling improved, her varicose veins improved substantially, and her legs felt much better, and she ultimately went on and had knee replacement.
I don't go to bed at night with my legs aching. I don't go to bed at night just sometimes almost in tears if I've had a real active day because my legs were so swollen and ankles were so swollen, and it made a huge difference for me.
The patients that I dreaded seeing previously in my practice, now I enjoy seeing them because I know that almost all of them have been seen and treated by numerous other physicians unsuccessfully, and I know that I can treat them successfully, not only for their wounds, but if they have swelling, pain, bulging veins, heavy, tired legs, all of those things can be successfully treated.
About a month ago, my great niece was over and wanted to ride bikes, and we ended up riding 4 miles that day. I could not have done that previous to not having the vein surgery because it's made a big difference in my level of activity.
Colleen had a robotic hysterectomy. She had abnormal bleeding after menopause, and that is always a very worrisome sign if a woman experiences.
My cervix was very thick, and above all my symptoms, and because of my age, I'm 62 years old, so it was time.
Now, Colleen was potentially a case of uterine cancer, so I decided to do a robotic hysterectomy on her so that if we needed to, we could continue after the hysterectomy looking for cancer in other places.
I was very impressed with Dr. Imtiaz when I came into her office and her staff. They lined all of my appointments up for me. I just couldn't have been happier with her. I knew as soon as I met her that I was going to be in good hands. She explained everything great.
Robotic hysterectomy I usually do for patients who may have other conditions that preclude them from having a routine laparoscopic hysterectomy. Some of these conditions could be a very large uterus, or if we suspect cancer, or if the patient has had multiple abdominal surgeries and we are suspecting adhesions or scar tissue inside the abdomen, or in patients who are overweight.
When I get up in the morning, I think to myself, I just have so much to look forward to because I don't have that pain, that misery, and I have a lot of ambition right now. I mean, I'm able to do a lot more things, and I'm not constantly thinking about, oh my God, I don't feel good today.
As a gynecologist, as a surgeon, it makes my day when I see a patient get up and walk out shortly after her surgery. I think it's silly to have somebody bedbound for 6 weeks, not be able to walk around, not be able to take care of her household, when the answer is simple. I know that I can get them up and about and moving and back to their life immediately.
For more information on any of the doctors you've seen on today's show, go to our website, bestdocsnetwork.com. Now it's time for me to share a story with you. My passion is the prevention and treatment of cardiovascular disease. I've practiced 20 years, touching people's lives, saving their lives, ministering to their lives. Let's watch this story about one patient who came to my practice and how we helped that person.
as you get older, sometimes you have trouble finding words. So my daughter got all worried, so she'd maybe go to a neurologist. So he does his thing, go back later, he said, it looks like you had a couple small strokes. They're small, they're not gonna bother you. But, he says, you need to go to a cardiologist to check out your heart, just to be on the safe side.
Valvular heart disease encompasses many different entities. The heart has 4 different valves, and Gary Singerman had actually infection and rupture of his mitral valve, which is a very important valve separating the top and bottom chamber of the left side of the heart.
So she sent me to Houston Northwest Hospital, where she had them ordered ultrasound for me. I feel fine. Can I go home now? So my wife and I are sitting there, and she comes in with this film of the ultrasound. She says, could you see the mitral valve there? I said, no, I'm not trained for that. So she points with it to her pen and says, right there, it's hanging down in the ventricle. It's been ruined with the bacteria, and it's not doing anything. And so she says, within a month, you're gonna have a massive heart failure. And I heard my wife gasp, and I got rocked. Wait a minute, I feel fine. She said, I'm checking you into the hospital right now.
Mr. Singerman had mitral valve prolapse, therefore the valve was not closing properly, was redundant and thick, and therefore it was easy for bacteria to stick to that valve and cause infection. And this happened before I met him, and his story is quite interesting, how he came to me. He immediately needed surgery because his valve was infected and ruptured and not working at all. But he's very thankful that he came because we were able to save him.
Obviously, I lived, but the point is I may not have if Dr. Varughese hadn't caught that ruined mitral valve, and so I owe her.
I kind of came to a realization that I obviously was not healthy, and it got to the point where it was kind of borderline embarrassing going shopping, and I would shop for clothes and I would cry in the dressing rooms, and I realized at that point it wasn't 5 pounds that I had put on, it wasn't 10 pounds, it was I had gained about 100 pounds without really even, I can't say I didn't know it, but I think I was kind of in a state of, denial.
Stephanie's lost all of her extra weight, so that's ideal. We don't expect that, we hope for that, and she's achieved that. She's achieved it because the surgery's given her a lot more control, but she's exercised that control.
I got the surgery March 5th of 2012, and I've lost about 115 pounds.
She's really changed how she eats and limited it to very healthy things, natural things, local organic things, all of which have pretty much a low glycemic index. She's cut out almost all the animal fat out of her diet, and that's ideal.
Everything has changed. Just a different joy. My kids are proud of me, and at work, working is easier. I realized that it was absolutely the best thing that I ever did, not only for my life right at this moment, but for my life forever.
Her whole approach to eating has changed, and she's involved her family and friends and coworkers in that. And that will produce an effect known as the halo effect, which is that patient having the weight loss surgery can actually transmit better lifestyle to some of the people around them, and those people actually benefit from that.
And so everything has changed. How I saw myself, how I see myself, how I see food, how I cook, how I shop, everything. Totally, I feel like a totally different person.
High cholesterol is a major problem in this country as well as in many countries around the world. High cholesterol leads to atherosclerosis, blockage of arteries that affect many organs throughout our bodies. So how can we effectively treat high cholesterol? There are medications, but sometimes medications can cause multiple problems for patients, multiple side effects, muscle pain, weakness, breakdown of muscles, liver dysfunction, to name just a few. So we know that natural has always been the best, and we look for natural therapy with regard to cholesterol reduction. There is something that we use called Bio's Life Slim, which is a fiber product created at Stanford University about 20 years ago to treat high cholesterol in those patients who are intolerant to medications. It's been there for 20 years, but not many people know about it. We use it in our practice, and we've taught many doctors how to use this effectively to lower cholesterol. LDL is lowered by 30%, triglycerides lowered by about 50%. So ask your doctor about Bio's Life Slim. Look for it. It's an amazing therapy, and it will help you to change your life. Our smile is such an important part of our lives. Keeping a healthy smile is also important. Dr. Paul Metz is an oral surgeon who helps patients to keep their healthy smile. Let's watch this story about a patient and how he helped them.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility in Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more of what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
Today we're here with Dr. Reynolds Delgado at the Texas Heart Institute. He's the Director of Cardiac Transplantation at the Texas Heart, and we're so happy to have him with us. Dr. Delgado, thank you for being with us today.
Well, thank you, Annie.
Now, we know that cardiac transplantation is something that seems so far removed from most people, but really so many people are in need of this great help. And can you tell us a little bit about how you evaluate a patient for transplant?
Yes. Well, first of all, there's a lot of people that need it, as you say. Around 6 million people in the United States have heart failure, and a good proportion of those need a transplant. The problem is we only have around 2,000 donors' hearts available to us in the nation per year. So we really have to focus on those patients who can get the most out of those 2,000 donors. And so really that's the focus when we're working somebody up for transplant, finding someone who's going to live a long, healthy life after the transplant.
Exactly. Now, there are several ways of helping the patient, right, with assist devices. Would you kind of mention those for us?
Yes, and the transplants are a limited resource, so we only have that limited number that we can do per year. But there are other things we can do that are not. An example is the artificial heart devices. These are known as LVADs, or left ventricular assist devices. And these are small motors, small motor pumps that are tiny, about this big, that can be implanted with a surgery in the chest, underneath the heart, and they can pump blood for the heart. And so really in a failing heart, we have other alternatives like this.
We see that there's hope for people who can't even get a transplant. They could come and be evaluated for even this assist device.
Absolutely, absolutely. There's so much we can do beyond transplant. And as for transplants, we do many of them. We did 57 in 2012. That's a lot of transplants. It's one a week. But one thing it's important for people of Houston to know is that herein, where we are standing and sitting, is the greatest med center in the world. Just right there, it's the greatest cancer hospital in the world, and here is the greatest cardiac hospital in the world. And within this med center, we can do just about anything that's doable in medicine.
That's excellent. Thank you, Dr. Delgado. We really appreciate you.
Thank you, Annie.
I came to Dr. Lewis because I always wanted to have really white teeth. And my teeth were straight. I never had to wear braces, didn't have any of those issues, but I had extreme sensitivity. So I could not use any of the whitening strips or just the gels that anyone could. My gums were receding probably because I am one of those brushers that brush the wrong way, didn't do the circular motion.
She really wanted veneers. She had just gone through a lot of personal stuff and she wanted to make a change in her life, but she really did not want her teeth touched. She did not want anything reduced on her teeth or anything prepared.
So he sort of walked me through the process, and I found out that what he could do was I didn't have to have any, didn't have to have my teeth all filed down. They just sort of buffed them, and he just recreated sort of my smile. It's really strange because it didn't change a whole lot, but it did change a whole lot.
So we did the set on her, and they turned out beautiful. I've done thousands of them, and people are very happy with them. And what we found out is, in most cases, they're stronger. Even though they're very thin, they're stronger than regular veneers because the strength isn't derived totally from the thickness of porcelain. I mean, you have to have a certain thickness, but it's derived from the bond to the tooth. And we found that when we bond to the enamel, which is the natural outer layer of the tooth, that we get a much stronger, much harder veneer.
Just the craftsmanship was amazing. I mean, it was like going to a Da Vinci or somebody, because it was such tiny details, but it really changed my smile.
So in actuality, not only are they, less destructive to the tooth, or you don't have to take anything off the tooth, but they're also stronger, and so they look great.
It was painless. Came back, put them on, was getting my hands massaged during the whole process, and I walked out and I had a perfect smile that looked natural. I enjoy smiling, and I love having people say, "Oh, you have the prettiest smile."
What a fabulous show we had today. I hope this helped you to discover some things that you need to do to protect yourself and your family. The Best Docs Network features some of the best physicians in the Houston area that have helped change people's lives. For more information for any of the fine doctors that you've seen today on today's show, head to our website at bestdocsnetwork.com. If you have a question or a comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. See you next time.